This podcast is brought to you from the lands of the Turrbal people. We also acknowledge the custodians of the land that you're listening from. Before listening further, please be aware that this podcast deals with information, descriptions, and words relating to sexual violence. It's not suitable to listen to around children, and you may well find it causes distress. You might choose to listen to it somewhere where you're comfortable and you feel safe, or even listen with a support person. Reaching out for support is an extremely brave thing to do, and help is available. You can call the Sexual Assault Helpline on 1800 010 120 between 7:30 in the morning and 11:30 at night, 7 days a week. Or call Victim Connect on 1300 318 940, 24 hours a day. Both services have specialist counsellors who'll always listen and believe you. And you can remain anonymous if you like. Hi, I'm Kay McGrath. You might recognise my voice as I worked as a journalist in Queensland for many years. Through that role, I've had the privilege of meeting people like you, people who've experienced and survived trauma. Hearing your stories has inspired my work outside journalism, and it led me to get involved with the Daniel Morecambe Foundation and Act for Kids. I'm also a patron and co-founder of Protect All Children Today. I co-chaired the Queensland State Government Domestic and Family Violence Prevention Council that was established by Dame Quentin Bryce as a result of the Not Now, Not Ever report. And I'm also a founding member of Women in Media Queensland. This podcast has been developed by the Office of the Victims Commissioner in collaboration with many people who work with and advocate for victim survivors of sexual violence. Thank you to all of our contributors. This podcast has been recorded for victim survivors of sexual violence, family members or friends supporting them, or people who work with people who've experienced sexual violence. We often hear that for victims of crime, it's hard to find the right information at the right time. It's difficult to understand the processes which you may have to go through if somebody has hurt you. You'll have to meet and talk to people you've never met before. They'll use words that you may not have heard before. But I believe strongly that having information from somewhere you can trust will help you make decisions about what is best for you. Before we begin this episode, I'd like to take a moment to acknowledge that this is a difficult topic, but I want you to feel safe as you listen to this podcast. You can listen on your own. You can listen with someone you trust. You can listen at your own pace, all at once, or in parts. And of course, you can listen as many times as you want to. I think it's important that we begin by acknowledging something bad has happened to you or is happening to you. There's nothing that I or any of the other contributors on this podcast can say to undo the hurt that's already been done. Please know the information included in this podcast is to help you seek help or report the violence. It won't take the place of professional support from experienced and qualified support workers or legal advice from lawyers. And let's acknowledge that you may feel nervous or scared. Dealing with the police and the courts can be scary and frustrating. I think it's important we understand the legal system in Queensland is built on processes, not on personal experience. It's important to remember that victims all have different experiences and stories, which can leave people feeling like no one understands their hurt or that no one is listening to them. Your experience of hurt may have been caused by someone you know, someone you've had or are still in a relationship with. You may not have even realised that you've been hurt until you shared your experience with someone else. You may have been very young and not understood what was happening to you. You may have blocked it out, tried to forget because remembering is just too painful. Your trauma may have led you to make decisions that you might not have made otherwise. You might have used drugs or alcohol to manage your feelings. Regardless, we hear you, and there is a network of support services who can help you. We have a Victims Commissioner in Queensland. The Victims Commissioner is an independent role and separate from government. The Commissioner provides advice to government about how things can be done better to meet victims' needs. You can visit the Victims Commissioner website to learn more about the Charter of Victims' Rights, which are rights for victims of violent crime in Queensland. In this episode, we're chatting to two professionals from Queensland Health. Natalie and Sam are both from the Forensic Medicine team. So let's come first to you, Natalie. You're a qualified doctor with 18 years' experience. You've been working in forensic medicine for the last 10 years. What's your current role with Queensland Health? And tell us exactly, what does a forensic examiner do?
Hi, Kay. So I am a senior forensic physician at Forensic Medicine Queensland, which is part of Queensland Health. And I'm the clinical lead for sexual assault services in Queensland. So what I'm doing is working very closely with doctors and nurses across the state, and we're involved in training and education and support for sexual assault examinations.
Okay, clinical forensic medicine. It's a mouthful and it does sound slightly intimidating. Can you break that down for us? What does that actually mean?
So clinical forensic medicine is the field of medicine that assists with the investigation of crime in living people. So it's different to forensic pathology, which is focused on investigating crime on deceased people.
And autopsies, that sort of thing.
That's right. So in our field, this involves examining victims of crime, collecting evidence, providing expert opinions, interpreting medical evidence for the court. So a forensic examiner has two roles. So we're essentially wearing two hats. We are both the clinician for the patient, so we are looking after their clinical needs and part of that support response. But we're also a forensic examiner, which means that we are there to look objectively at the case and to collect evidence. So it's really important that we remain impartial.
So just to reiterate, you look for and provide evidence if a case goes to trial, and you might also be called to appear in court and give your expert opinion. Sam, you're also highly qualified in this area and you work alongside Natalie?
I do. I'm also a senior forensic physician at Forensic Medicine Queensland. I, alongside Natalie, give training to nurses and doctors who wish to undertake sexual assault examinations. Natalie and I were also involved in the development of the new sexual assault examination kits, which were rolled out in the middle of last year. And we're doing ongoing work to help refine those, and also hopefully launching an early evidence kit before the end of this year too, to assist with people who are presenting following a sexual assault examination who cannot get an examination immediately for various reasons, or need to do other activities like they need to eat or drink or something that might mean that the evidence can't be retained, and we wish to collect it before they do those activities.
You've raised a lot of things there that I'd like to learn more about. But first of all, Sam, can I ask you, I've heard physician and doctor. Can you just briefly explain to us the difference between those two?
Sure. In a broad sense, a physician is someone who's done training and has qualifications above their basic medical degree.
Okay. In our previous episodes, we've talked about the different options that people have after experiencing sexual violence. What can somebody expect if they go to hospital following an assault? How seriously are they going to be taken, and how quickly will they be seen? Natalie, perhaps to you?
So at the end of 2023, the Queensland Health Minister gave a direction to all public hospitals that all victim survivors should be seen within 10 minutes. This doesn't mean that they will have a forensic examination within 10 minutes, but it does mean that they will be looked after and that they'll be commenced on the clinical pathway that will address their health and safety needs. Most hospitals have a sexual assault service, but occasionally a hospital transfer to a neighbouring facility that is better equipped to perform the examination will need to be arranged. I think it's important just to mention that sexual assault pathways are available at the public hospitals. So this is something that Queensland Health has oversight over. So if you were to present to a private hospital, they aren't part of they aren't part of this process, so they won't have access to the kits, and it's unlikely that they have a trained examiner available.
That's really important to know. So what can a person who presents at a hospital expect? You've told us, Natalie, that they need to be seen within 10 minutes. What will happen next?
I guess the thing that needs to be sort of reiterated or to be pointed out is that when a person presents to hospital, what they need to know is that they'll be treated in a trauma-informed way. And that means a number of things. The first thing it means is that they'll be safe. It means that they'll be cared for by people that they can trust. It means that they'll be believed about their sexual assault. It means that they won't be judged about the circumstances in which the sexual assault happened. And it also means that they'll be in control of the complete process. So anything they want to happen, anything they don't want to happen, the pace at which it all happens will be completely up to that person.
So at hospital, and we've heard about the Charter of Victims' Rights, there are expectations about the way they're treated. And Sam, you're making the very important point that they have control over this medical exam.
They have control over the whole process, okay, including the medical exam, yes.
Yeah, that's so important to know. So the first priority, I would imagine, is that you attend to any physical injuries that they might have.
Correct, yep. There'll be a few medical concerns that will be associated with some sexual assaults, and those are dealt with first. They're our priority. So care for a person medically always takes priority over forensic examination. That will include investigation of and or treatment of any injuries and also pregnancy prophylaxis. So that means if there could be an unwanted pregnancy as a result of that sexual assault, we can give prophylaxis or medication to try and prevent that happening. Also, in some cases, treatment of sexually transmitted infections that they may have contracted during the assault.
Yeah, that's really reassuring and important to know that option and that treatment is there. So moving on to the forensic examination, sounds a bit scary, is it? And what's involved?
So the person will be provided with information about what a forensic examination is and what their choices are. The purpose of a forensic examination is to collect evidence for court. So this might include skin swabs, genital swabs, urine, blood, even clothing. And sometimes we might arrange for photographs to be taken if there's a patterned injury on the body. Of course, we do not take photographs of intimate areas or genital areas. It's really important for us to distinguish a forensic examination from a medical procedure because a forensic examination is not therapeutic. So what that means is it doesn't have a health treatment benefit. Another important thing to emphasise is that it's not diagnostic. So what that means is that we can't diagnose what has happened to you. So, for example, if we see fluid when we're doing our internal examination, we can't, with our naked eye, tell if that fluid contains semen or not, or say anything about the DNA. So we're essentially just collecting the evidence for that to be analysed. So even though we can't diagnose that a sexual assault has happened, it is still a very important part of the police investigation. It's important that people are aware that a forensic examination can be quite invasive, and for some people that can be distressing.
And they may choose not to, I guess.
Absolutely. For some people it may not be the right choice. And there are other avenues that they can pursue. So we need to make sure that the person understands fully what's involved and then that they actually provide written consent. And so we can't proceed with the examination until we have written consent.
So there again, it's important to stress that the people that you see have been through a trauma, and here's an opportunity for them in some way to try and regain some control, some power over the next steps. And Natalie, the victim survivor, I understand, has 3 choices when they present at hospital. Can you outline those for us?
Sure. So the first choice is to have a forensic examination with police involvement. So this is the usual forensic pathway, and you might hear that being referred to as the collect and analyse pathway. The second choice is to have a forensic examination without police involvement. And this is just in case the person later decides that they want to make a complaint to police. And so this option allows for early evidence collection whilst providing the person time to decide what they want to do. Right. So we call that collect and store because essentially we collect the evidence in the exact same way, but then it gets transported to Forensic Science Queensland where it is stored for up to 2 years.
Securely. And the third option is?
The third choice is to not have a forensic examination, but to receive clinical care only.
And they're not going to be judged in any way, shape or form if they choose one of those options, one of those three options.
That's right. So only the person knows what's right for them and they'll be supported no matter what choice they make.
Not pressured to perhaps bring the police in. Let's step through this process of a forensic medical exam.
So first of all, it involves having a chat with the person about what happened. And usually that's actually the longest period of time that is spent in our interaction with the person. And the purpose of that chat is just to get them to give us a brief outline of what happened to allow us to decide where we need to look for injuries and what evidence needs to be collected. Also, we have, as Natalie said, a discussion around consent about what is going to happen, what the next steps are and what they're happy to consent to happen. The examination itself is pretty quick, usually takes about 30 minutes. And that pace can be dictated by the person as well. They can get us to speed up or slow down, depending on what makes them feel comfortable. I've had people, stop it and go out for a smoke, stop it and wait for their support person, and that's all completely fine. That's, absolutely up to them.
Can you explain the process to us?
So when we're examining them, generally we start off with just a top-to-toe general examination. We look for any injuries, and again, that's guided by what they've already told us about what happened. We swab any areas with a cotton swab, which just looks like something you'd use to clean your ear out, but it's just on a slightly longer stick. We swab areas where we think there might be a DNA of the offender. Then we have a look at the genital region for any injuries. And then finally, we collect swabs from the genitals using the same cotton swabs.
Sam, can I ask you, it is terribly personal and there's no getting away from that. Can a person request that they have a female doctor or if they prefer a male doctor?
It really depends on the resource of the hospital. Absolutely, they can request it. We may not be able to provide it. And there are ways that we can approach, there are different ways we can approach it. It might be that they wait a few hours for, the person of their chosen gender to come on. It may be that all the other people that are involved are female, that, the support person and the nursing staff that are interacting with them are female, but ultimately, at the end of the day, there are constraints, but that then can be discussed with the person who's presenting and we can find a path that's suitable for them to go forward with.
So back to the forensic examination, your task is to find DNA.
So after we look for any injuries, after that is when we take the specimens to look for DNA. So we start just externally using our cotton swabs, but to collect a sample internally, it's preferable for us to use a speculum. So that's the same duckbill instrument that we use for pap smears. So it would be a very familiar process for a lot of women. However, if a person doesn't want to have a speculum examination, we can put that swab into the vagina very gently, just blind, or they may alternatively choose not to have it at all. And again, that is their wish, and that is totally fine.
Yeah.
We try and explain what we're doing and tell them why we want to collect evidence from certain places, but ultimately the decision is theirs, and we don't put any pressure on people to have a particular part of the examination that they don't wish to have.
No. And again, as you said, there's no judgment attached to that either. So thank you both for explaining in detail. So you're collecting DNA, you're looking for bruising, etc., which prompts the question, what is the time limit on presenting to hospital and having a forensic examination? Natalie?
The forensic examination is time sensitive and ideally should occur within 72 hours, but in some cases it might be performed up to 7 days after an incident, just depending on the nature of the assault.
So the first 3 days is ideal?
Yes. So this is due to the loss of evidence over time. So there's really 3 things that we're thinking about. First of all is DNA evidence. So DNA retention times refer to how long we can continue to detect DNA. This can vary upon the site of the body. So if it's on the skin, the mouth, inside the mouth, the anus, the genital tract, All of those locations have different DNA retention times. It also depends on the type of biological fluid that was deposited on them. So whether it was skin cells from touch or saliva from maybe kissing, blood or semen. So all of those biological fluids have different retention times as well.
So it's quite complicated, isn't it? So what other sort of DNA do you look for? What if a person's been drugged, for instance?
So we do collect toxicology in cases where we suspect there was drug-facilitated sexual assault. So we collect blood, and that's usually if they present within 3 days. And we also collect urine, and that's usually if they present within 5 days. If people present after that, there is still the option to collect hair samples for hair toxicology, and that would be collected 4 to 6 weeks later. So it'd be a matter of making an appointment for them to come back and have their hair collected.
So, sorry, just to be clear, if a person has been taken advantage of, there could be evidence of that in their system for up to a month or longer.
Well, certainly the ideal way to measure that is by looking at the blood, because we can look at the blood concentrations and we can interpret that as far as timing and make some conclusions from that. The next ideal sort of source would be the urine, because it often lasts in the urine a little bit longer, but we can't draw the same sort of conclusions from the levels that we see in urine.
Right.
And finally, there's hair, which is a great option because you can collect that for as long as, if someone has very long hair, it's basically like a calendar of drug exposures that goes back months, maybe even a year, and you can do the segmental hair analysis and look to see what drugs they were exposed to within different time frames.
That's fascinating.
That can be really useful depending on what the actual question is for the investigation. So sometimes, we will certainly do hair analysis.
But to be clear, the sooner the better.
That's right.
There is certain evidence that will be lost quite quickly, and that depends on the type of evidence it is and where on the body it is. So, for example, a lot of the evidence we collect is DNA evidence, and if I get your DNA on my skin, for example, Kay, that can be lost quite quickly within a day, much more quickly if there are other activities that I do, such as shower, have a bath, sweat a lot, go swimming in the sea, or particularly in chlorinated water, because we know that chlorine can degrade DNA quite quickly. And so we prefer people to come in as quickly as possible to get evidence collected. Having said that, there can be evidence that can be collected many days later that is still of use. And there is equally evidence that can be collected quite a long time later. For example, DNA that's left on clothing can persist for a long time. If we're talking about trying to detect drugs in a person's system, while we prefer to collect blood and urine early because we get a better idea of drugs that have been used in, for example, a drug-facilitated sexual assault, we can equally collect it from hair many months after the event. Hair can provide a bit of a calendar in terms of when certain drugs have been taken. We know that hair grows about 1 centimetre a month. And so for each centimetre section we look at hair, we can sort of have a rough idea of when people have been exposed to certain drugs within that time frame.
That's fascinating. Can we just revisit and be clear on some of the activities that might destroy DNA evidence? You've mentioned having a shower or swimming. What else?
Well, for instance, with penile oral penetration, things like brushing your teeth, using mouthwash, eating or drinking, those sorts of activities could result in loss of evidence.
And what about even going to the toilet?
Yes, so for cases where it's been penile anal penetration, if you do pass a bowel motion, that will result in loss of evidence as well.
The best advice for people listening to this is to present at hospital as soon as possible without showering, which might be your first instinct. Would that be correct?
Yes, the earlier you present, the better. And if you are able to avoid any activities that could wash away DNA, we would encourage you to do so.
However, it's all about the well-being of the victim survivor.
Absolutely. So, if someone really wants to have a shower, they should do so. It's just important that we document in our record the activities that they have done, because then that goes to the lab, and the scientists who are analysing the DNA evidence can then get an understanding why there might be DNA present or absent on certain samples. So that's really useful information for the DNA scientists.
Thanks for explaining that. Often drugs, including alcohol, play a part in sexual assault. How quickly does that evidence leave the body?
It leaves it quite quickly. Within a few days, most drugs won't be detectable in blood, and within 5 to 7 days, most drugs won't be detectable in urine. There are some drugs that disappear very, very quickly. One of those is a drug that's referred to as a date rape drug, so GHB, gamma hydroxybutyrate, that disappears very quickly. Within a few hours we can't detect it in blood, and within about 12 hours we can't detect it in urine. And unfortunately GHB is one that we can't currently detect in hair. So that is why we urge people who feel that they have been drink spiked, or if they have had a drug-facilitated sexual assault, and by that I mean they had drugs in their body, whether they took them themselves or they were given them by someone else, but the drugs in their body meant that they weren't able to fully comprehend what was going on, or certainly were not able to consent to having a consensual sexual encounter, to come in as quickly as possible, because the earlier we can collect evidence for that, the better.
And again, just Sam, before we move on, to admit that you had taken a drug yourself, will you be judged when you present at a hospital?
No, not at all. And that is part of the trauma-informed care that I was talking about before. You will absolutely not be judged about the circumstances of your sexual assault. You know, if you drank a little bit too much, more than you thought was wise, and you ended up in circumstances you weren't anticipating, you don't deserve to be sexually assaulted. If you were smoking a point of meth with a friend's friend and things got out of hand, you don't deserve to be sexually assaulted.
Everybody deserves to be safe. Natalie, can I come to you to talk more about this drug-facilitated sexual assault and what you're seeing?
Yeah, so as Sam has mentioned, sometimes the drug or alcohol might be consumed voluntarily. So it might be something that you've knowingly consumed. And sometimes it may not be voluntary, and it might have been slipped into your drink or something like that. What we see is alcohol is the most common substance that is involved in drug-facilitated sexual assault. But unfortunately, we don't really have very good data for the other drugs, because some of the drugs that are used are very short-acting and disappear from the system very quickly. So we really don't have a lot of information about how frequently other drugs like GHB, which is gamma hydroxybutyrate, how often that is used.
Natalie, should people be concerned if they've taken an illegal or illicit drug that perhaps they may be charged sometime in the future? Is that a concern?
So this is a question that we've been asked, and we've actually discussed it at length with our Queensland Police Service contacts. And so we can reassure people that they won't be charged or prosecuted if they say that they have taken an illegal substance, or if it is detected in their blood and urine sample, so that they can feel reassured that if they admit that and it is found, there won't be any further repercussions with regards to that.
And the other time-sensitive concern is, I guess, the rate of healing, because different parts of our bodies heal faster than others. Can you give us an example of that, Natalie?
Yeah, so I think probably everyone's really familiar with biting their tongue or biting their mouth or their cheek.
The cheek, yeah.
The cells that line your cheek, we call that like mucosa. And it's very similar to the lining of your genital tract. And so I think, you probably find when you bite your tongue or you bite your cheek, you're very aware of it, but then within a few hours you've forgotten about it, and then there's probably no evidence of any injury the next day, just because that part of the body heals so quickly. And it is similar for the genital tract. So, some of those injuries can heal, within a day
quickly.
or two.
Mm-hmm. So again, the sooner the better. Sam, the purpose of this podcast is to prepare people for this process. So let's ask some more difficult questions. And can you describe perhaps what's involved if a person needs to be anally examined?
Sure. It's not dissimilar to vaginal examinations. So we would first examine for injuries. We would also do a swab externally around the skin around the outside of the anus. When we're talking about collection of evidence within the anus, we can, depending on the time frame since the assault, We can either just gently put a cotton swab in 1 or 2 centimetres very gently inside. If it's been a longer time, ideally to collect evidence, we would use what we call a proctoscope, which is a similar concept to a speculum, but it's much smaller, so that we can get the swab in a little bit deeper to collect evidence. We understand a lot of people don't want that and don't tolerate it, and so it's quite frequently refused, and that is fine. And in those instances, we would, again, just pop a swab in very gently but blindly to the length that we need it to go in and collect the swab that way.
Reason why we prefer to use a speculum or a proctoscope is both for our ability to visualise the inside, so the inside of the vagina or the inside of the rectum. So that can be really important if there are injuries. So for instance, if there is a tear or something like that, from both a forensic perspective but also from a health perspective, we'd want to see that and see how severe it is. And the other reason why we prefer it is because it means that when we collect the swab, whether it's from higher up in the vagina or higher up in the rectum, we're doing it under visualisation, and we can actually see where we're placing that. And we know that we're not sort of dragging anything from the outside in. We're just going directly to the site of collection. So that's the rationale for why we encourage the use of it, but certainly we don't want to pressure anybody into doing something they don't want.
But you can do a better job and possibly gather better evidence. So, which leads me to the next question. Does agreeing to this forensic exam process mean that you have to report an assault to police?
No, not at all. We have, as Natalie talked about before, we have a collect and store option for people aged 14 years and over. When we do a collect and store, we do exactly the same examination. We collect exactly the same samples, except those samples are stored at the lab and they are not analysed unless the person elects to make a report to police and for the case to be investigated. So if the person gives consent and a report has been made to police, then the lab will go ahead and do the analysis of the samples to look for DNA. So if they want time to think about it, and want to use a collect and store option, the samples stored for 2 years before they're destroyed.
So they have plenty of time to make their decision. Tell me, do you always find some evidence of an assault?
In terms of what we can see visually, in terms of injuries, and specifically I assume you're talking about in the genital region? No. In fact, it's quite normal not to see any evidence of injury. So there have been lots of studies done on this, and we know that most people who have been sexually assaulted, and when I'm saying this I mean vaginal penetration, won't have visible injuries. Equally, we know that a lot of people that have consensual penetration, as in sex with a partner that they want to have, can sustain injuries. So the presence or absence of injuries is a fairly neutral finding and doesn't really tell us whether there's been consensual sex or not.
We've touched on this before, but let's revisit it so that it's really clear. Generally, how long does a forensic exam take? And we've already got a sense that it can be somewhat invasive.
So generally, on average, a forensic examination would take about 3 hours. And as I said before, the longest period of time is spent having a chat to the person first of all. Also, a significant period of time is taken decontaminating the room that we're going to use. So the examination itself is actually reasonably quick. That is excluding any medical care that has to be delivered to the person beforehand, and things that influence the time it takes to investigate and treat injuries is multifactorial. So there are a lot of things that can influence the time that it takes to do that.
Of course. So people should be prepared. It's obviously not a quick process, and you have to be thorough, and it's a very important process. So a person has presented at the hospital, and now they've decided that they do, in fact, want to involve police. What happens from there?
So as we said before, it's completely up to them what they choose to do. If they decide they'd like to involve police, then this would be following the collect and analyse pathway. So the evidence that we collect when we perform a forensic examination can be really helpful for the early police investigation and can, guide them as to where they might need to look for further evidence. So that might even mean that they need to return to the crime scene. It might be that there's an item that's been left behind that we find out during the course of our history taking, and we can then alert police to that. It's also used as evidence in court. So essentially the evidence that we collect may support the version of events that's provided by the person. And usually the hospital would contact police if police weren't already there. And police would come on in and they need to be there at least for the end of the examination, because we hand our forensic medical examination kits directly to police and provide a handover with the record as well, which forms part of their investigation.
They certainly wouldn't be in the room, I wouldn't imagine, while you're doing the exam.
No. But they can be if that's what the person wants. So we've had certain situations where, for instance, it might be a female police officer and they've developed rapport, and sometimes they might choose them to be the support person. But unless that's what they asked for, the police officers would not be sitting in on the history or the examination.
And again, the person has control. They can make a complaint to police, but they can withdraw that at any time. Is that your understanding as well?
That's right. So they can withdraw their complaint at any time, and this sort of is because this is their choice. There is an exception to this, though. A child or adolescent under the age of 16 years who has been raped by an adult over 18 years, this is a specific sort of criminal matter that police need to be involved in. And so this is a crime that doctors and nurses are mandated to report to police.
Mandated means?
We must report to police. So what it means is we can still perform the examination as a collect and store, but we inform them that we need to let police know about this, and police might come and speak to them, and then police will decide whether or not it needs to proceed.
This is in the instance, again, of a person under 16, so a child who has been assaulted by an adult, somebody over the age of 18.
Yes.
So that's just to be clear on that. Now, if they don't want to involve police, what other support is provided at the hospital?
So it's variable across the hospitals. Each facility has a different setup, but usually there is either a social work service or a sexual assault support service that is attached. So a person can be referred to the sexual assault support service or to a social worker.
And people have the right also to bring a trusted friend, a family member along with them. Will they be allowed to be in on the exam?
Oh, yes, absolutely. They can have a support person of their choice, and as you say, it might be a family member or a friend. It might be a sexual assault support worker. It might be a social worker. It might be, as Natalie said, a female policewoman. If it's a female who's presenting after sexual assault. So the support person, whomever they decide, they can be in during the history taking or the chat we have. First of all, they can be in during the physical examination, they can be in for both, or they can be in for neither. It's completely up to the person who's presenting.
And do most people opt for that support person? I would imagine it would be quite comforting to have somebody there.
It's really variable. Some people don't want anyone. You can't, it's not very predictable, actually.
Individual decisions. Natalie?
I guess it's important to add that if the examiner is of a different gender to the person who's presenting and requesting the examination, that you do need to have a chaperone.
The other thing I would say to people about having a support person in while we do the examination is we position that support person right up the head of the bed, face to face with the person they're supporting. So, they're not down the end where we're doing the specimen collection.
Sure. Thanks, Sam. Now, you can also opt to see your local doctor, your local GP, if you don't want to go to hospital. Is that correct?
So your GP can be an incredibly supportive person during this time, and they can assess your clinical needs. They can, examine you for injuries and provide some of the clinical care, like what Sam was describing, pregnancy prophylaxis, or even treatment for sexually transmitted infections. But unless they're a government medical officer, they are not part of the local sexual assault pathway. So they actually don't have access to the forensic medical examination kits. Those are kept up at the hospital.
So your GP might suggest you go to your hospital?
Yeah, so it would probably be that the GP would refer you on to hospital to have the formal forensic medical examination.
And if you do firstly go to your local GP, does that doctor have to report the assault to police?
No, it's up to the person person's own choice if that person is an adult. As Natalie has said, if you're under 16 and the person who's assaulted you is 18 years or older, then we have legal obligations to report that.
Just because you talk to police about what's happened doesn't mean that you have to formally report what has happened. You can talk to police anonymously. For instance, you can report the crime if you want police to be aware of a potential predator, but not actually proceed with an investigation or give the police any of your own details.
And it's police, Sam, who might actually suggest that you present to hospital.
That's right. They might recommend that you go to hospital to get your injuries treated or looked at and to have evidence collected. And as we said before, you may want to take a support person with you if you decide to go to the police station or then on to the hospital.
There are many vulnerable members of the community, and I'm sure some are listening, who would feel quite reluctant to present at a hospital under these circumstances. What assurances can we give them, Sam? How will they be supported?
They will be supported, Kay, and we do recognise that there are vulnerable members of our community who not only present less frequently, but in fact they are more likely to be victims of sexual assault. They include First Nations people, the elderly, people from other non-Anglo-Saxon cultural backgrounds who may not speak English well or at all, members of the LGBTQIA+ community. And we are aware that they have need of extra support often, and that will be offered to them through the sexual assault support services or through the social worker who will be seeing them. The other members that don't present readily are males who are sexually assaulted, and they can often be men who are identifying as heterosexual. There is a lot of shame with being assaulted, particularly by another male. They have shame and they have questions over their bodily responses to what happens during that assault. And we understand that. We can give them support. We can give them reassurance that whatever happens during that assault does not affect their sexuality. Their sexuality after the assault is exactly the same as their sexuality prior to the assault.
And they're not being judged?
Not at all.
If I can just add to that too, I think that society's stereotypes also are another barrier for men to present, because I think that the stereotypes suggest that men should be able to defend themselves and the complexity of the assault, may mean that they haven't been able to. So there's also those issues as well that can be quite complex.
Masculinity. Yeah, that's a good point. Thanks, Natalie. Let's talk about other areas of the general body that you would focus on and why that's important. What sort of evidence would you gather there?
So an important part of our examination is the head-to-toe examination that we perform. It's quite a thorough examination. Even though the person might tell us a story which is very much directed towards the sexual assault part, they might not be aware that they've sustained other injuries along the way. And so if we have their consent to, we will do a very systematic review of their body, and we'll look at every part without overly exposing them. Like, we have privacy sheets, and so we'll look at everything from their face, their eyes, in their mouth, behind their ears, their scalp, and just looking for any signs of injuries that might be a bruise or a scratch or an abrasion, which is like a graze. And so all of those injuries that might seem fairly minor can actually help to tell the story of what has happened. And it's really whether this pattern of injury, whether that might support their version of events, and that can be really important in the court case.
And provide more context and, as you say, a bigger picture. Sam, we're hearing more about non-lethal strangulation. Do you see that often, and why is it important that somebody report that?
We do see it, Kay, and we know there's a very strong link between domestic violence, sexual assault and non-fatal strangulation. We also know there's a number of reasons why people don't disclose non-fatal strangulation, and in fact, when we sit down and have a chat, we actually ask specific questions about it. We know the barriers to disclosing it are people might be ashamed of it. They may not feel it's relevant in the context of presenting for a sexual assault. They may be worried that they're not going to be safe after disclosing it, and they may also not remember it, because we know that the area of the brain that codes memory, short-term memory. The hippocampus is very sensitive to lack of oxygen. And so if you've had your oxygen supply cut off, we know that sometimes you can't remember that that's actually an event that's actually happened. So we do ask after it for those reasons. I should say also the reason that we ask about it is because often there is no visible injury, and that can occur even when there has been very serious, deeper injury to the deeper structures of the neck. In the majority of people, the injuries will be minor, but there is a small minority of people that will have very serious injuries. And of course, sometimes it's fatal strangulation that occurs, not non-fatal strangulation.
And also repercussions could happen many years down the track.
That's right. You know, there are increasing studies being conducted into this area showing that repetitive episodes of strangulation can cause problems cognitively, just like we know that repetitive head injuries can cause problems cognitively for people. And that's a very common story. We know that it's often not a one-off incident. It used to be that if you were strangled by someone, there were sort of two charges that were almost at the ends of the spectrum. Choking or strangulation within the confines of a domestic relationship is now a standalone criminal charge in the state of Queensland.
This has been a really candid conversation, and I want to thank you both, Natalie and Sam. It's really valuable information, and hopefully our listeners will feel more informed and therefore more empowered. They've been through a potentially traumatising experience, but by listening to this, they have an idea of what's ahead and they have an opportunity to take control of the next steps. So thank you, Natalie and Sam from Queensland Health.
You're welcome.
Thanks for having us.
Victims of violent crime in Queensland have rights. You're a victim if someone has hurt you. You've experienced sexual violence. You're a victim of domestic and family violence. Someone has killed or hurt someone in your family. You were hurt because you helped someone when they were being hurt. These rights are outlined in the Charter of Victims' Rights. Government and government-funded agencies that work with victims of crime must uphold the Charter of Victims' Rights. The Charter has different rights at different stages of the criminal justice process. Throughout the entire process, you have the right to be treated with respect and dignity, to have your personal information kept private, and to be informed of support services and options. You have the right to make a complaint if your rights aren't upheld. When police are investigating, you should be told about the investigation. You should be told if someone gets arrested. If the case goes to court, you should be told when court meetings are, be provided information about whether the person who hurt you applies for bail, and if you have to be a witness in court. After court, you should be told if the person who hurt you goes to jail, and you have the right to information like how long they'll be in jail. You can read the Charter of Victims' Rights, including an easy-to-read version in 8 different languages, at victimscommissioner.qld.gov.au, or ask the service working with you for a copy. The Sexual Assault Helpline has specialist counsellors available to talk from 7:30am to 11:30pm 7 days a week. Phone 1800 010 120 to speak to the team who'll always listen and always believe you. The Sexual Assault Helpline can provide you with options depending on your situation, as well as information, advice or counselling. They can also provide you with referrals to free counselling and support and medical care, including emergency contraception, medical examinations to collect evidence, and testing for sexually transmissible infections or STIs. That number again for the Sexual Assault Helpline is 1800 010 120 from 7:30am to 11:30pm 7 days a week. I hope you found this episode informative and useful. In our next episode, we'll be discussing reporting sexual violence to police. Feel free to keep listening, or if you need to take a break and come back later, that's fine. This content can be distressing, so please remember to take some time to speak to a trusted friend or counsellor and check in with yourself. Take care, and I'll speak to you soon.